So for otoplasty patients, ideally you want to wait at least until age 5 or 6. At that point, the ear has attained about 85–90% of its vertical height. In other words, you don't want to do surgery on an ear and have it end up being smaller because you restrict the growth relative to the rest of the face and the head, etc. So about age 5 or 6 makes the most sense from a growth standpoint. It also turns out to be psychologically somewhat important because that's unfortunately when kids can start being a little bit meaner to each other. And so when you get teased a little bit, so that's a kind of a good confluence of those two things, both psychologically but also biologically as far as the growth goes. We tend to see a lot of patients in their tween and teenage years. A lot of patients are involved in activities at that point where they're putting their hair up, and so that becomes more of a psychological social issue as well. But I've had inquiries on 78-year-olds for otoplasty, and I've seen people that were in their professional life that think that everybody's looking at their ears when they walk into a courtroom as an attorney. And so we really do it across the spectrum, but the minimum age is really 5 or 6.